The reason that Legionella is such a challenging pathogen, there are really two reasons, I think. I think there's a clinical reason and then an environmental reason. From the clinical standpoint, Legionnaire's disease really looks like a lot of other severe pneumonias. There aren't many things that really distinguish it, but yet it requires specialized testing. And so a clinician has to be thinking about Legionnaire's disease in a differential for someone with severe pneumonia, and they have to actually order the right test. And then if the test is positive, that has to be reported to public health for then a public health response to be initiated and an outbreak investigation. So getting the word out to clinicians to always be thinking about in the appropriate patient population, patients at risk, that Legionnaire's disease could be a possibility, and then order the appropriate tests, which include a urinary antigen test as well as a deep respiratory specimen for culture on selected media. So the clinical side is one, but then the other challenging thing about Legionella is its relationship to the environment. So Legionella is found in fresh water. It's out there. It doesn't usually cause a problem in the environment naturally. It's when it gets into large complex building water systems with lots of dead legs and old piping and biofilm around the pipes and that kind of thing, where Legionella can grow and then be transmitted through aerosolizing devices such as shower heads, fountains, that kind of thing, to susceptible populations. So a lot of, so Legionella growth and transmission can be prevented in building water systems, but building owners and managers need to know that, and a lot of them don't, and so that's a challenge too, is getting the message out that routine maintenance of building water systems can actually prevent disease. And then on the response side, it really requires a special skill set and some resources that aren't always readily available to investigate an outbreak of Legionnaire's disease. And so that can be a challenge, building and maintaining capacity at state and local levels to investigate outbreaks of Legionnaire's disease.